Terry. I'm 24 years old from Vancouver, BC. I came over to Toronto for breast augmentation by Dr. Mulholland. The first time I knew about Dr. Mulholland was Real Housewives of Toronto, and I think he's a great doctor, as well as his wife is awesome. I was pretty intrigued because he seems very professional, and that's what kind of drew my attention. And so I did my research and I found out that he's been in the business for 20 years. I think the moment that kind of convinced me was when I felt my friend's breast augmentation, and it felt really natural. It honestly felt real to me, and that's what made me want to get them done. I honestly thought maybe after 4 years or something they'll start looking saggy, and she told me that she had them for 8 years. Obviously, gorgeous girl. She had her breasts done and it just looked perfect with her body, right? Just her breast size and then her hips. I like that hourglass look, and that's what I wanted to aim for as well. I'm not gonna lie, appearance is everything, especially in the industry that I'm in. I'm planning on going into sales, and I think that's a big impact on my career. I want my surgery, my breast augmentation, to look more natural. Currently I'm a size B and I want to be a size C. I'm 5'5", and that's why I think something a bit larger would suit my figure. Because I'm not a short girl, I'm not a tall girl. I want to get implants where it is noticeable, but not too dramatic. I don't want it to look like Pamela Anderson, nothing too big. One of my biggest concerns is the scarring and just how I'm going to feel afterwards, because I know for the next couple of days after my surgery, I'm going to have a difficult time eating, moving. I know some patients, they get nauseated, and some patients actually have a quick recovery, so that's another concern of mine, whether if my body can adapt to the implants. My insecurities, it's probably when I don't have my bra on, and just the look of my body, because it's very disproportionate. I think I'd feel more confident and more comfortable in my own skin if my breasts were larger. I'm excited for my results afterwards, just so I can put on my clothes, my dresses, the low-cut V-neck tops.
Terry, good to see you again.
Nice to
Our
see you
big
too.
day. Are you excited?
I'm nervous, but more excited.
Nervous, excited, that's normal. In fact, if you weren't, I would go, what is wrong with this girl? She's having surgery.
Right.
Okay, so it's normal to be a little nervous, but a little sprinkle of excitement too.
Okay.
It's going to go very well. You're in good hands. Dr. Tam is your anesthesiologist. He's been doing this for 2 decades. So his job is to take you off into La La Land and safely bring you back so you don't remember things.
Okay.
It's quite short. I do the procedure in about 45 to 50 minutes. The hardest work of all has been done, which is you using the Vector 3D to find the right implant. Did you find it useful?
Yes, I did.
And so you had a look at all kinds of options. You look at the very big and the very small.
I did.
Aren't you glad you didn't pick 290 or 330?
I'm super
I
happy
bet
with
you
my
were always
decision.
thinking
Yeah.
300 maybe.
That's what I was thinking at first, and then when I saw the 3D imaging, it made me choose 415 instead. It convinced me to choose 415.
Well, I certainly saw from the chart that that's what you had picked, and to me, that is why Vector 3D and pre-op imaging and a good center that invests in that really liberates you and emancipates you from the tyranny of what the surgeon might think for you,
Right.
rather than what you might think for you. My job, do a perfect operation, perfect incision, small pocket in, close it up, and then you've got a healed up.
Okay.
Those two things almost always happen, which leads to this high probability of a great outcome for you. Since 1997, I do about 400 operations a year: face, nose, breast, lipo, tummy tuck, other body contouring. Those are the most frequent procedures that we perform. Now we've got our incision up, and so we're going to go through that incision, and we're cutting through the fat, and out comes our sterile implant. There we go. Now, slowly open that implant. And we're going to add some antibiotic ointment to that antibiotic solution, again, as sterile as can be. And this is a special sterile funnel. It means that the implant will not touch the surface of the skin at all. Sterile container called the Keller funnel, ready to be inserted. And so it's very unusual to get a breast implant exposure with this careful closure.
I feel as if there's a bit of a pressure on my chest. I felt like a little bit of nauseated after my surgery. It comes and goes, but like now I'm feeling a lot better.
So it's been 4 months so far. I feel fully recovered. There is a little bit of scarring, but it's not noticeable since my breast is covering it. But from what Dr. Mulholland told me, over time it's gonna fade away. And if it doesn't fade away, he does offer laser. I'm very happy with my decision. It's probably the best decision I've made yet. It's made me so much more confident. I feel like I want to dress up all the time. I want to be in a bathing suit, just want to show off my body basically. I love my hourglass figure. It's nice for me to wear tops that are more low cut, dresses that are backless. I don't have to worry about my breasts looking saggy or flat. Recovery wasn't too bad. I wasn't mentally prepared for the first week. The most difficult part of recovering was probably sleeping. There was a lot of pressure on my chest. I couldn't sleep on my sides, and I normally sleep on my sides, but it wasn't too bad, to be honest. After a month, I just started doing light cardio, nothing too vigorous on my body, but after 3 months, I started going back to hot yoga, and yeah, it was okay. For the first month, my boobs were fairly swollen. They were very large, and I was kind of worried that that was a permanent look. But I didn't want it to look bubbly and fake. I wanted a natural look, but Dr. Mulholland told me that over time it's gonna drop. So after a month, it started getting softer. The nurses gave me some techniques of how to massage them so they have a nice drop to them. My friends are really surprised of how natural they look. I showed one of my girlfriends my boobs and she felt them and she was amazed at how natural they feel. Vectra helped me out with my decision quite a bit. It exceeded my expectations. With what I saw from Vectra and what I have now, it looks almost identical. So with all the research I've done, I'm happy that I selected Dr. Mulholland because he did such an amazing job. If you're debating on whether or not if you should get your breast augmentation done, I definitely recommend you to go online, do your research, find the right doctor, and see who's out there that has gotten their breast augmentation done, just to see what they look like and what they feel like as well.